Thanks for joining. Please feel free to either put in the chat, or if this is your first meeting, or if you're just feeling chatty today, feel free to introduce yourself and tell us your name, your organization, and one success or positive experience that you've had this week. And I can go ahead and start. My name is Kim Stinchcomb. I'm with the Prince George's County Health Department. I'm the manager of the Healthcare Action Coalition. And one success for me, which is going to sound small, but I packed my lunch this week. It was a big success.
That actually is a huge success because Kim never packs her lunch and is always starving. So we support eating lunch in the office. And I have a success to share too. This is like super specific and many people will not understand why I'm so excited. But I'm Caitlin Murphy. For anyone who doesn't know me, I'm with Prince George's County Health Department. I'm the Associate Director of Health and Wellness. And after like 4 years, I think, of not having a budget administrator for the Health and Wellness Division, we got a position approved for a budget administrator, which is crazy because everybody got cut this year. And we ended up getting a budget person. So I'm like dancing. I'm super excited related to that.
It's really good. I'm Dr. Ernest Carter. I am currently at Kennedy Krieger as the Director of Health Equity Research and Innovation. One of my successes this week is that I was at a summit on advancing precision in health assessments, and we made some significant progress in that area. And in neuropsych, that's really a big step. So it was in Denver. It was a good time, and we made significant progress, and that'll help actually throughout a lot of it'll help with a lot of social determinants because we put social determinants in all precision health assessments. So that was a big step.
I know more people have had good things happen. Let's kick off with some excitement. Anybody have anything else?
I will. My name is Deborah Collier. I'm senior epidemiologist at the Prince George's County Health Department. And I guess success or positive experience was we recently got a little puppy and he had a little gash on his head. I was out of town. I came back, had a little gash on his head, but turns out he'll be fine. So that was a nice positive experience. But yeah.
Anyone else can please continue to share your name and your organization in the chat if you feel like sharing any additional positive experiences. Oh my gosh, and Kelly, I'm so sorry to hear about the accident, but I'm glad that everyone is okay.
He was driving home from work and a tree fell on his car.
Wow.
He was lifelined and 3.5 hours of surgery, but he came out okay, and we're very happy to still have him.
And happy birthday, Nina, to your oldest.
Thank you. It's hard to believe. I think everybody feels that way, though.
Hi, I'm Sharon Zalewski. I'm with the Regional Primary Care Coalition, and I can share progress, maybe perhaps not success. As some of you may know, the Health Assures program was eliminated from the county's budget, and we have gotten a lot of support from some of the council members to put funding back in the budget for Health Assures and to move forward with perhaps expanding and enhancing the programs to cover services for the uninsured residents of Prince George's County. So I feel like it may not be a final success, but that progress is worth applauding. So I just wanted to make everybody aware of that progress in the county.
They've got a good advocate in you, Sharon. So I'm
but the advocates get tired after a while.
fair.
All right, we're continuing to have people jump in, but let's go ahead and jump into our agenda today. So we finished up our welcomes and introductions. We've got a presentation planned from one of our partners, the Community Engagement and Consultation Group, and then we'll open up to any questions and answers for them. And then we're gonna go over the CCT updates and what we've been doing in the last month for engagement and our next steps. And then we'll finish up with any community announcements. Just sharing our CCCT direction. Our vision for the group is Prince George's County is a place where everyone has access to high quality and effective healthcare services that are well managed, seamless, and tailored to their specific needs. And our mission is empowering healthier lives through efficient care coordination with a strategic systems approach. So today I would like to introduce our speaker, Amoya Anderson, a student ambassador with Community Engagement and Consultation Group and a senior at Towson University studying healthcare management with a minor in business administration. She desires to make a meaningful impact in healthcare, which drives her passion for improving healthcare systems and promoting equal access to quality care. To deepen her understanding of healthcare administration principles, Amoya actively seeks opportunities to engage with peers and faculty. Her strong work ethic complements her collaborative nature, and she is eager to prepare for a career in healthcare management. So I will pass it over to you.
Thank you so much. Well, good morning, everyone. Again, my name is Amoya Anderson, and I'm one of the student ambassadors at Community Engagement and Consultation Group. Like Kim said, I'm studying healthcare management. I'm currently a senior at Towson, about to graduate in a couple of weeks. I'm passionate about everything dealing with child health and maternal health. And so if anyone here is looking for an undergraduate, please contact me. But share the slides. Can everyone see the screen?
Yes.
Okay, good. We can move on to the overview. Right, so I'm just gonna go over the agenda a little bit. So we're gonna be talking about who we are, our corporate governance, our target populations, any internal languages spoken here, our strategic goals, our business model, how we do what we do, affiliations, and our staff. So we were established in, wait, is the screen changing for you guys?
No, we are just seeing, it's not in presentation mode.
Try it again, Tim. Give us 1 second. All right.
Looks good.
Great. Okay. So I'm gonna just go over the overview again. So we're gonna be talking about who we are, our corporate governance, our target populations, any internal languages spoken here, our strategic goals, our business model, how we're able to do what we do, and our affiliations and staff. So who we are. CECG was established in 2017 with the purpose to promote positive change, one community at a time. Our mission is to bridge gaps and create workable solutions toward health equity and reduce health disparities for different communities that we try to serve. Our vision is to be a trusted leader in community engagement and improve access to essential resources. Where we serve mostly people in Prince George's and Montgomery County. About 88% of our clients come from both of those counties because there's a lot of cross-sectional resources there, but we also serve Frederick, Howard, Baltimore County, and Baltimore City. Our corporate governance, we have a 12-member board of directors with 5 executive committee members and 5 competitive advantage committee members. These are the people who help the organization function the way it does and as effectively as they do. Our target populations, we serve the Capital Regional Service Area. Like I said before, residents in Montgomery County, PG County. We serve limited English proficiency speakers and as well immigrant communities. We serve anyone really who needs assistance. We try and help them the best way we can. And if we're not able to help them ourselves, we try and direct them into the path of somebody who can help them, but we always try and give somebody an option the best way we can. So these are some of the internal languages spoken here at CECG. We have a lot, I won't read them all, but we have French, Spanish, Darien Pashto, we have Haitian Creole, Italian. The unique and beautiful thing about CECG is that all these languages are spoken internally. We have a very multicultural staff. We have a couple of polyglots amongst us who speak up to 4 languages. And so we really pride ourselves on being very diverse and making sure that we serve as many communities as possible. Now I wanted to go into our strategic goals for the 2024 to 2028 years. I won't go into each one in detail. I'll just read the pillar itself to respect time. So we have 5 pillars in total, and these pillars are wonderful and have helped me understand nonprofits a little bit better. Due to time, like I said, I won't go under each one, but we'll go through them. The first one is conceptualizing whole person health to advance health equity and complex care coordination. Our second goal is engaging communities through community partnerships to provide inclusive services. Our third is strengthening collaboration and partnerships with community leaders to promote health equity. And our fourth one is advance the public health workforce. CECG has had 48 interns within the last 4 years. We have had different unities that we collaborate with, like Towson. While being at CECG, I've learned about what it means to connect with your community and meet them where they're at and try not to have bias or judgment when speaking to somebody who's in a different position than yourself. Being able to build relationships with others and networking and build relationships with partners who have the same goals in mind. I've been able to do outreach at libraries and faith-based organizations, resource fairs. And I've even been able to start an initiative here where I am trying to reach out to high schools to help educate students about career exploration and options they have outside of high school that they may not be privy to. So I'm really excited about that. And CECG has just taught me, and not just me, all the other interns as well, about what it means to work towards solutions, build relationships with your community, and really think outside the box and being creative. And the fifth one is deliver inclusive behavioral health strategies to improve outcomes within minority populations. Our goal at CECG is to reduce the stigma attached to mental health. Our founder and CEO, Dr. Malui, is a trained mental health first aid instructor in adolescents and youth. She uses her expertise to drive home the importance of mental health. And now I'm going to get into how we're able to do what we do. And now I'm going to get into how we're able to do what we do through our cross-cultural business model. So first, we have awareness, our assumptions, values, and biases. Being aware of our assumptions and making sure we do the work to debunk those. We interact with a lot of people from different backgrounds, like I said, different walks of life. So it's important for us to be aware and not judge and come to them with an open mind and an open heart. We also have understanding, a worldview of culturally and linguistically diverse clients. We try and serve everyone. Our clients come from different continents, faiths, regions, knowledge, cultural differences, assessments, and intervention strategies just understanding and valuing cultural differences is key in our work and opening our minds up to different cultures. And skills, we provide assessment and interventional services through targeted case management. And this is just more of how we do it through our cross-cultural business model continued. The beauty about this business model is that it looks at health and social needs. We meet people where they are. We have colleagues that meet with people in their homes, their places of worship, and try and have one-on-one conversations with them to get a better understanding of who they are. Now, our customer intelligence platform, this is our platform where we are able to understand the best ways to interact with each individual customer. This is our OneTalk app that's installed on all of our colleagues' cell phones to ensure clients receive the resources that they need whenever they need them. Our colleagues will receive a phone call or a text from the clients, and they can connect with them immediately during the workday at any time or any place. This was created by Verizon to allow us to gather important data that we can use for future initiatives or to improve initiatives that we already have. And who doesn't like data? And now how we do it through our funders. So we have funders at the federal, state, and local level. CECG is a SNAP outreach provider for pre-screening application and redetermination. We also get funding from the Maryland Community Health Resource Commission and the Maryland Department of Health. And we get funding from all the different counties that we serve. And now how we do it through our programs. So we have our Community Resource Education Program, or CREP program, do outreach and targeted case management. We are a SNAP, where we give out food assistance and have eligibility presentations, enrollment and redetermination, and same for our Medicaid or health insurance program. And then a couple more of our programs, we have our workforce training program, where we're able to address the social determinant of health through career pathways and try and give people who are entering the workforce better skills to help them prepare, like resume writing, interview skills, workplace etiquette, how to dress for the workplace or for an interview, just trying to help people the best way we can with that. We also have our supportive services like our Home to Home initiative. This is our community closet where we're able to give out free men's, women's, and children's clothing, as well as a few household items out to the community completely for free. We also take donations. We also have our True Comfort initiative where we have female bras, underwear, feminine hygiene products that we give out completely for free, as well as our English conversation classes. We have our Emerging Public Health Workforce Initiative, and this is where us as ambassadors or interns fall under. CECG collaborates with AARP, where they have been able to fund this program and support it for us. And now how we do it through our partners and collaborations. So we collaborate with community-based organizations and faith-based organizations like Manna Food Center or Mobile Med or ISHWA or ICC. We also collaborate with interfaith homeless shelters. We basically collaborate with whoever wants to work with us, and where we feel like we can really collaborate and like make a difference, we try and like work with as many people as possible. And now how we do it through our businesses. We have LinkedIn Learning, our Zips Dry Cleaners, and that's where our Home to Home initiative comes into play. Sometimes when people drop off stuff at Zips Dry Cleaners after a year, if they haven't picked it up, we come in and collect those clothes, and we also give out those clothes through our Home to Home initiative. And our higher education institution, like I said before, we collaborated with a couple of different institutions like Towson and the University of Maryland, and we collaborate with a lot of different schools to try and give students an opportunity to really get an understanding of what it is to work in a nonprofit space. And how we do it through outreach. So we do it through community events like resource fairs of libraries and faith-based organizations such as churches and mosques. We have in-person office visits via appointment, cloud accessibility with 24-hour calls and follow-ups, and regional co-work office spaces to meet with clients in partnership with Perfect Office Solutions. And then here are our affiliations. I won't go through each one of them, but a couple of them are Leaders in Equity Regional Collaborative, Black Physicians Health Network, and the Mental Health Association of Maryland. So yeah, these are a couple of our affiliates that we work with. And then here's a breakdown of our organizational chart. the top, we have our CEO and founder, Dr. Malumi, and then our board of directors, and then all of our different staff in their different departments, as well as us ambassadors over there in the corner. And that is all for my presentation. Are there any questions? I know I kind of went fast because I wanted to respect the time.
So thank you for such a great presentation. You have a lot of services and you address a lot of needs in the community. So this is very informative, and I knew a little about your organization, but now I know a lot about your organization. So that was a great presentation, and we really appreciate it. And we hope that you join our CCCT, because it'll help us with furthering our mission to make sure we optimize how we do care coordination, and the services that you provide are essential to helping a lot of our people. It can fill gaps for some of our organizations who need your services. So we really appreciate that. So I just wanted to tell you that and tell you and thank you for such a great presentation.
Thank you so much. I appreciate that.
So just so we know, I have a question. So we know how to connect our residents with your services. If we were interested in calling on your group to do, I don't know, to be at a certain place or do an event, what would that process look like? Or how do you prioritize where your team will be?
I have another one of the staff members here who's going to be answering any questions, just because I am a student intern, so I don't know everything. So she's going to take it over from here.
Alrighty. Hi, my name is Odaris. I'm the Multicultural Engagement Specialist here. One way how you guys can reach us out for, let's say, if you have an event, would normally be to either call or email us. I can put our information down in the chat. Basically, we would like to know a week in advance just so we can prepare and have all our staff ready and equipped.
Thank you.
I don't have a question, but I just wanted to say I love your strategic goals. I was like taking notes because I feel like the way that you word them is like also kind of my goals for the Division of Health and Wellness. So they're very, very good. I can tell that a lot of thought went into those, and just excited to have you here.
I had a question about when you do you utilize a service like Find Help, which used to be called Aunt Bertha or 211, or other resources such as those to help you with your identifying resources in the community and linking to those resources?
So what we do is we basically start our own projects here within the company. So True Comfort is my project. It's where we get, the monthly sanitation products for women, especially the ones that recently come into the country who only have clothes just on their backs. So we put in like our time and effort to do the research. Google is our best friend here. Other than that, if we don't have the resources, we can always direct the client to either our partner, or we will use findhelp.org and 211.
The other question I have for you is that when you, with your clients, what system do you have to track your clients? How do you track your clients? What kind of documentation system do you have?
So we use Google for the workplace. We have a dashboard that just has the basic information. So that could be like the client's name, email address, phone number. The zip code is very important to us because that helps us determine what county they're in and what services we can give them. Other than that, I know people come through us through either like outreach or just word of mouth. We are very popular right now through WhatsApp, so that's fun. Other than that, most of our data and client information is HIPAA compliant, so we do not share anything and nor will we give it out. And that is just for us to build that trust with the client.
I hate to be the only one asking questions, but I will ask you another question. So do you have, if we have entities that want to make referrals to you, do you have, how do you, and I know you probably just said it, but I want to be sure that I understand all of the ways you receive a referral. Do you have a electronic format to receive it? Do you do it by paper, by phone? I'm just trying to understand what your front door is, digital or non-digital front door. How do they get to you? And then once you do your work, how do you get information back to them that the client has been served?
So I want to say like 2/3 of our formats is digital. I know through our website or through our flyers, we do have QR codes. The client can scan it, they fill out the form, we get it through Google Forms, and then we just go from there, talk to the client, see what they need. I will say we are appointment-based only just because our office is pretty small, but we still appreciate walk-ins, regardless whether it's over the phone, in person, or digitally. Or even through email, we will always give you our wraparound services. So if a client is asking for SNAP, we'll help them out with that. But we also go with, do you need help with anything else?
Thank you.
And I just saw in the chat, we have a request for your slides if you're able to share them.
Yeah, I'll get back to that. Yeah, I can definitely ask our boss for that.
Sounds good. Okay, any other questions? All right, well, thank you all so much for joining and being part of our group and for your presentation today. We'll be sure to follow up with any additional questions that come in, but we really appreciate your time. So just 1 second, everyone, and I will pull up our slides for the next piece of our updates. Okay, and Caitlin or Dr. Carter, do you want to walk everyone through some of the findings from last month's CHW panel?
Sure, Caitlin and I'll tag team this. So from the panel that we had the last meeting, we found that many of our community health workers are using Aunt Bertha as a platform, and we had a lot of great meetings for Aunt Bertha. Now it's Find Help, and we had a lot of great meetings. We had a great meeting with Find Help. They showed us a lot of functionality that they have, and one of the things that we discovered is that we could probably we probably only utilize a very small piece of their entire functionality. And if we marry that with what 211, and as we start to look through how we can do this, I think we can come up with a really robust way of helping our community health workers with finding resources and doing that in a way such that it's efficient for you, as opposed to how you might be using it now. You may be using it sort of as an adjunct to many other things, but it actually has a lot of robustness. And so that is one update I wanted to be sure we shared with you, and that we're actively looking at how we can actually marry Find Help with 211. It turns out that Find Help and 211 both are linked to CRIS. And so we have opportunities with CRIS. I had a meeting with the medical director at CRIS, and he's very excited about doing whatever we need to do in order to make our care coordination services more effective. So that's an update about with respect to that. I'll hand it over to Caitlin for the second
Yeah,
one.
for sure. So I'll just kind of add to that a little bit by saying, and I think this is I'm glad you clicked the next bullet point, because this is what I was going to say. So it sounded to me, based on what the CHWs were reporting, that they were using services like Google and Find Help to kind of identify the resources that were available. And then they were keeping internal documents to say, this is a good resource, this is open on XYZ day, this, these people are very responsive, kind of like keeping their own log of what obviously are the most, high yield resources to connect people to. And so one interesting thing, as Dr. Carter said, that we learned, the sort of core team here learned from meeting with Find Help, is that they have a whole internal sort of suite of tools for free where you could do that tracking. Our teams could do that tracking within Find Help's platform. So we actually did not know that any of that existed. And I think it would be a good resource to explore. So we may, in a future meeting, see if maybe Find Help can come talk a little bit about what they talked to us about, because I think everybody would be pretty interested. They said they also have like regular trainings for community partners to help them learn about how to use the tool and things like that. So that was something that was interesting, that basically there was use of the inventories just to search for things, and then keeping of those internal documents, which I think may be a lot of work for everyone. And then there was feelings that a standardized process might help them track outcomes. I know that a lot of, we actually just went to a community health worker sustainability summit for our CHIS grant. Me and Liz and a couple other folks from our team, HCDI's team and CASA's team. And we figured out that, well, we didn't figure out, the CHWs have been saying this from the beginning, but that the way that we track data a lot of the times is not working. So like the Excel documents, the Microsoft forms, that there's better ways of having our, like, documenting our processes and our step-by-step, in the referral sequence and completion of referrals that are less resource intensive and would give us the data, better data on what we are doing. So we're interested in that as well. Definitely data and the difficulty of capturing it is something we hear all the time from our community health workers. And then in terms of challenges, we definitely heard, language barriers are a big challenge, not having services within someone's preferred language, but also not having services available for everyone. So as Sharon pointed out early on, we don't do a whole lot for undocumented individuals when it comes to insurance or covering medical care, which is a major need, obviously. If you don't have documentation, then there's not a ton for you. So I know that's something that's frustrating. Also, a lot of sometimes translational requests that CHWs get, where they're asked to kind of provide interpretation for different services that may not be within their standard protocol, but that they're willing to help with because they know that they're advocates for the residents that they serve. And so sometimes that can lead to like really long times that folks are on the phone with residents and helping them with things. And we also heard that it's critical. The one critical thing that community health workers do is that they're advocates for people. So they can call, do a three-way call with the resident and, let's say, a social service organization or some organization where they're trying to sign up for benefits, and can kind of stand up for them and make sure that they're getting the services that they need. Let's see what else. So yeah, there's definitely those issues for those who don't have IDs or social security cards. And sometimes they're able to obtain those, but that is also a process. So, we've seen CHWs like accompany people to go get a ID or something like that. It can be all the way back to, getting a birth certificate or things like that. And then, there's always the balance of kind of numbers of cases with the depth of cases. So some people need help with one quick thing and you're able to provide it, and then they go on about their life. And sometimes people need hours and hours of help every day. And so there's sometimes a difficulty kind of figuring out how to balance all that. Dr. Carter or Liz, is there anything else that I missed?
No, I think you got all of it.
No, I think you got it pretty well.
And if any of our community health workers are here, is there anything that you want to add or expand on related to that? I don't mean to speak for you.
So with that review of last month's meeting and all the lessons learned from our community health workers that joined and provided their expertise, as Dr. Carter started to mention, we've had some discussions. Well, we've already had our discussions with 211. We just met earlier this week with Find Help, and a lot of the resources that are available within Find Help address some of those problems, not all of them, but they have translation services within the network, but then there's still the limitation of what resources are available in multiple languages. So it does seem like that we can utilize these services to help address some of those barriers. Does anyone want to elaborate on any of those additional steps? I know Dr. Carter kind of touched on it already, the meeting with CRISP and EPIC.
Yeah, the only thing is that just so that everybody understands where we're going, is that we are looking at how the CCCT is looking at the global infrastructure for doing care coordination. And so that all your all's care teams, with your community health workers and other members of the care team, will have a common infrastructure that's optimized. How you get your resources, how you communicate, how you document data, so it's standardized, so that the CCCT and by default the health department, both local and state, can look at how well you're influencing the population that you're targeting. Are you really improving their health care with your coordination? But what drives that is the data. We have to get population-based data from pre and post. Like, what was the population before you intervened? What is the population after? In order to do that, we have to have systems with standards and ways of collecting information and optimized use of resources. So we've been making, I just want to say I'm proud of everybody because we're actually making really good progress toward that. And so ultimately we are going to put up models of the infrastructure that we are proposing to use it. So how can CCCT better coordinate care services? How do we help you? How do we build the infrastructure that costs all kinds of money that you don't have? So you're doing the best you can because you're doing care coordination in a very localized way. And what we know for sure is there needs to be public health infrastructure to help people who want to do work, just like with the organization that we just saw, the CECG. They do really good work. They need a care coordinating infrastructure that can help them and they can help us. But we have no way of really communicating with them. And that's what is clear. So the CCCT has this obligation. This is our mission. This is our next, this is how we go about doing this. And we need all of y'all's input as we put all these building blocks together, because we got our little building blocks out there, but you don't know what we're building yet. It doesn't, it's like an erector said, all you see is the screws and well, I'm going back to my childhood. Let me just let go to Legos, because that's my children. It's like all the little Lego blocks, but you're building something. So you want to say, okay, Dr. Carter, what actually are we building? Because we've got the blocks. So I think we're going there. And I'm just saying to you all that, I can see it. And I know eventually everybody in this group can see it, but everybody in this group contribution is very important to building what we're trying to build. It's not a lot of places in the whole country that have infrastructure to help with care coordination, but it always has been a goal for people who've been in this space. So anyway, I just wanted to say that so you'll understand that's where we are and that's where we're going. And I think the presentation today was extremely helpful because you can see how this organization they haven't been around that long. I mean, honestly, 7 years, and they've been working and doing really great work. And we have organizations similar to or that are out there doing really, really great work. We've got to get them so that we can help them. All right. So that's all I wanted to say, Kim.
Thank you, Dr. Carter. And Jay, I see Jay put an additional resource in the chat. Jay, do you want to elaborate on this a little bit?
Sure. So I'm part of the Homeless Services Committee that is under the COG infrastructure, specifically in the co-chair of the Regional Case Coordination Learning Collaborative, which is working on improving coordination between all of the 8 jurisdictions of the Metropolitan Washington Council of Governments and our homeless service systems. And Roundtable reached out to the RCCLC specifically to offer the possibility of creating a platform for us. It is essentially like a discussion forum. It functions a lot like a social media platform, Facebook, or some of the discussion forums on like Reddit, or things that you might have seen on various websites, blog websites. So there's a place where anybody who has access to it can post a question or post a topic, share resources, and then get responses back. So it creates a community discussion about those resources or those questions. And then the other main component of Roundtable is a resource archive. So it's essentially like a library where people can upload resources. I've uploaded videos, video presentations that have been done for the Prince George's County Continuum of Care on topics around like legal issues, or connecting people to furniture, or connecting people to other local resources. You can upload a resource, or you can share a resource on that platform. You can tag it with a number of tags. So if people are looking for resources around housing, they would be able to see all of the housing related resources, or legal services for people who are undocumented. You'd be able to see all of those resources with one search. So it's essentially, Roundtable is essentially a resource archive and discussion forum on one platform. They have created a Roundtable platform for the RCCLC for free as a sort of a demo, and to generate some conversation around Roundtable as a platform. But I'm sure that they would be willing to work with any community that was interested in using them to develop a platform, and find a way that it wouldn't be cost prohibitive.
Thank you. Is that resource, is it community specific? So once you get the discussion forum, or once you get the resource, do you invite everyone in based on your partners, or can people kind of search based on their community?
Yeah, so there's a specific set of users that have access to it. The information, it's basically like a closed group. But there are a couple of us for the RCCLC, the two co-chairs and the COG administrative staff that are essentially admins for the platform, and so we can add other users. If there are new people that come into the group, we can create their profiles. It's very user friendly. I am not a forum admin by training, and it was very easy for me to use the platform. And then once you're within that group, then you can either search the discussions or search the resource archives for particular information. So it is a closed forum, but it's very easy to invite people into that forum. Can be expanded very quickly.
Thank you. That, I think we would definitely like to at least get some more information. That sounds great.
Okay.
Right, that brings us to our community announcements. Does anyone have anything going on that they would like to share with the group? We have a couple of community partners that shared events, and then I can open it back up. We have the University of Maryland Injury Prevention and Community Wellness Fair coming up Saturday, May 4th. There is a registration, but it is a free and exciting event. So that's Saturday, May 4th from 2 to 6, and they'll be doing CPR training, driver safety, car safety, fall prevention, fire safety, health screenings, and violence prevention activities. We also have the Greatest of All Time Expo, Mental Health Expo, coming up on Saturday, May 18th at Bowie State University. I believe they are still taking registration for people to have tables at this event. So if you're interested in having a table, it's very well attended, and it's an engaging event. I went last year. It's very well done. And I see a hand raised.
Can you hear and see me? It's Tara Pavo from Mary Center.
Yes, hello.
Hi, I wanted to share a community update and a service for that Mary Center is operating for PG County residents. We have an energy assistance program that our family support worker Brandon Lopos is coordinating out of our Adelphi location. So if you serve any Prince George's County resident who is really behind on their electric bill, or not electric bill, excuse me, energy bill, which incorporates electric and gas, Pepco, BG's, oh geez, I can't think of these acronyms, but the BGE gas as well. I'm going to put the phone number in the chat, but PG residents can call. The phone number is 202-545 2024. I'll put it in the chat and they can schedule an appointment with our family support worker, Brandon. He's dedicating Tuesdays and Thursdays to do these applications. And so that we have lots of money to help reduce that financial barrier for folks that even a $500 payment won't give a dent on their energy bill, especially those that even have threats of cancellations, disconnections. Even if some of the folks that we serve, if they don't have the energy bill in their name, as some of our community members, it's the reality check. Sometimes they don't have the energy bill in their name. We can also assist those as well. Thank you.
Thank you. We will be sure to share that phone number out with the group in the notes as well, so everyone can relay that. And go ahead, Kelly.
Caitlin, I just forwarded to you the Mental Health of America's Spanish toolkit that was just released, so that maybe you can send it out to whomever's in charge of the GOAT. And then we have partnered with NAMI of Maryland and Prince George's County for a 3-part series. The first one, which is today from 12 to 12:30, and it's What Can NAMI Do For You? And it's geared towards clinicians, community health workers, persons who are face to face with patients with mental illness or substance use disorder. Like I said, the first one will be Kate from NAMI Maryland presenting on what NAMI can do for families and clinicians. If clinicians are challenged with patients, they can certainly refer the patients and or family caregivers to NAMI for some assistance. The next one is the 4th Thursday in April. I don't know what May. And it is how to gain compliance, working with patients that are tend to be more non-compliant. And then the last one is the 4th Thursday of June, and that is de-escalating techniques for de-escalating behaviors. So I thought I sent that out to all of you, but Caitlin, I will send it to you to get out to the group if anyone's interested in sharing with their partners that are dealing directly with patients.
And thanks, Kelly. I do remember that. I know we've sent it out in our newsletter as well. So hopefully people are seeing that, but I'll be sure to send it out with the notes also. Thank you. Does anyone else have announcements or events coming up that they want to share? All right, if not, I can pass it over to Dr. Carter to close us up.
Well, thank you, Kim, and thank you everyone for attending. We're, we're moving forward. We got the engine revved up again. I feel like we're back on the track since we had that downtime with COVID. So look forward to seeing you next time. We'll make sure that, and if you have any suggestions about any topic that we're leaving out as we go on this journey, please email Kim and let her know. And the 4 of us, our group that meets on a constant basis, will make sure that we get that information to you. And hopefully we can update you about some grant opportunities the next time, because one of the things I think is really important with our organizations is you guys need money. And I know you are probably exhausted everything, but we're going to try to also help you with finding funding, because I think that's and if the CCCT can help augment any grant that you have or in any way, just let us know. So thank you guys, appreciate you, and we'll see you next time.
Thanks, everybody.
Thank you. Bye-bye.